concerns from the third sector about, ongoing funding and, not keeping pace with inflationary costs. So there are some concerns being raised with them. There was a concern raised that we weren't going to move across to a contract, which had been previously proposed at IJB. However, we are offering a 3-year grant funding with 3% uplifts as well. So that puts them in a more secure position for the next 3 years.
Okay, any more comments, questions? David Blackburn, online.
Thank you, Chair. Thank you, Chairman, for the paper. I wanted to explore the choice of voluntary organisations with whom we're working to ensure that we're supporting those organisations that we need to, and therefore wanted to ask how it was arrived at that these are the organisations we're supporting. Thank you.
So these organisations have been funded for a number of years and continue to provide a really sustainable and valued service across the city. The contribution of the counselling services are fairly unique across the city. There's not many other counselling services that provide the services that they offer. And in regard to the transport services, again, it's a unique service that's provided to the most vulnerable group of citizens across Aberdeen City. So in my mind, they are a very good use of money and well worth the investment going forward.
If I may, Chair, in the paper it describes over 100 counselling services in Aberdeen City, and hence I wonder why we've chosen those 4 that we have.
It's mainly to do with the unique services that these 4 provide, opposed to the other counselling services, which are a bit more generic.
I see. And while I recognise that we've always done it this way, I wonder if it's time to review the organisations that we're working with to ensure that we're absolutely getting value for money and the services that our community need.
So within the pack, there is a report which is on the counselling services, which details what they're doing, the number of people who are waiting to use their services. So that indicates that there is a real need for these services across the city.
Yes, I read the report, thank you. Of course, it may be that other organisations might be more efficient, for example, and therefore the waiting list may be reduced.
So as part of the strategic plan going forward and the delivery plan aligned to myself, as a commissioning lead, we will be working with our counselling services throughout the next year to look at efficiencies and look at how we can work more effectively with our counselling services to ensure that they are supportive of each other and working in a more collaborative alliance-based model.
Thank you. I understand the counselling services were reviewed, but the transport and other services were not.
So we will be working on a further review of those pieces of work going forward this year. However, the transport services that are offered for the city, again, are quite unique. They've been offering the services across the city for a number of years and have built up really good relationships with the people that they are supporting. So that there's hundreds of people that are registered to use the service, and they are reliant on these transport services to enable them to get to both health and social care appointments, which helps to keep them well, keep them in the community and keep them connected to medical appointments, which keep them well.
Thank you. I'm still minded that it's other transport services for example, may be able to provide the same service but more efficiently and so on. And I guess inherently I'm concerned about complacency in the organisations with whom we're contracting or grant funding.
So as I mentioned, we will be doing a piece of work to make sure that the transport services that are provided are as efficient and effective as they possibly can for the city.
Thank you. However, what we're voting on here, I understand, is a 3-year grant. So what is if the outcome of one of those review processes determines that the service is not quite what we were expecting, is there an exit clause for us?
Just looking around to see which officer wants to take that one.
So as part of the grant support that we offer to our providers, we have regular meetings with them, and we also have an annual review with them, which we look at how effective the money's being spent. So that'll be an opportunity to do a bit of a pause and reflect to see that we are getting the value for money. But the transport services are providing in excess of 400 journeys every month, which, you know, is a huge number of services to vulnerable people across the city, but we will build that into the annual review.
I guess I want to clarify that we have an exit clause for any of these organisations, even the counselling, if we determine that the service they're providing is not to the standard that we wish.
Thank you, David. We're happy. We'll make sure we build that into the contract with them. Thank you.
Thank you. Can I make one final inquiry, please? On January 31st, 2023, one of the services that was voted to be supported was service for sensory impairment, according to the paper. And I understand that we're supporting the Grampian Society for the Blind. Was that the intention in January 2023, that the sensory deprivation to be supported was blindness and not, for example, hard of hearing, etc.?
So if I can come back to you with that one, I'll go away and find out the information that you're asking and come back to you.
Okay, thank you. So
Okay,
does that mean we don't vote at this point?
So the service that's provided by the Grampian Society for the Blind helps to sustain people in the communities to remain independent and part of the community. So I think the money that's spent is worth the money to enable people to remain at home and as independent and contributing to their local community as they wish.
Yes, I don't doubt that. But for example, sensory impairment does not restrict to those who are visually impaired, and I'm concerned that the IJB voted in January 2023 for support of other sensory impaired organisations to support other sensory impairments.
The chair, yeah,
Yes, Claire, do come in.
Yeah, just to give you some assurance, Grampian Society for the Blind is known now as North East Sensory Services, so they do actually provide support and care to people with all sensory impairment. It's not just people with a visual impairment, just to give you that assurance.
Thank you.
I'll bring in Hussein.
Thank you very much, Shona, for the cover report and also for the scoping report that you did. I actually found that to be a really informative read. So I just wanted to put on record my thanks for that, but also a suggestion for when we have similar grant cases in future, it would be very helpful if we were able to have some qualitative feedback, anonymized, of course, from some of the service users, so that we not only see the information that the organizations are sending us, but we can also get some very raw, right from the bleeding edge, so to speak, as to exactly how people are benefiting from this and how specifically it's making an impact on their lives. And it's something I'm really passionate about, that we do really good work in the city, and I'm assured by what we do, but I think it's really important that we hear from those that we actually support, if we can do that in a way which respects their privacy, but also gives us that qualitative feedback. So just a suggestion for the future, if that's maybe something you could consider. But thank you very much for the work that you and your team have done, and for the reporting today.
Cool. I'm detecting a certain lack of complete contentment. Would you want to propose an amendment or something, or delay taking a decision? And if I can ask officers before you answer that, if we delayed taking a decision to get more info, would that have an adverse impact on the services? Is it a time sensitive thing?
Yeah, because the contracts end at the end of the month. So, if we delay it, then there would be a delay in the payment.
Sorry to be awkward. Could we roll it over for a month or two to allow more information to be got, or is that just overcomplicating things? Sorry, I'm thinking out loud here.
That would be an amendment to the recommendation that's opposed just now. So the IGB could agree to amend the recommendation to replace that with a 1 month funding if we were going to be calling it back.
So we could technically do it. David, yeah, do you want to come back in?
Yeah, thanks for that proposal, John. I'd be supportive of that amendment. By no means do I wish to deprive our community of these services. My concern is that, as I hopefully have explained earlier, that we're not doing this in the way that it's always been done, without taking a critical look at what is being provided, so that we're getting the best for our community.
I've got a hand from Neil Stevenson.
Thank you, Chair. If I may just come in, there quite possibly would be I'm not 100% sure, but there could be a staffing issue here if we only do a 1 month extension. If there's going to be an amendment, it may need to be, I would advise perhaps 3 months to these contracts to allow for if there are any changes going forward, to make sure the organisations have enough time to work and consult with their staff, which obviously really important in this process. Just from a procurement point of view, if I can add that I was very happy with the review and the reporting that was done around it. I think the transport question, I think it would be good to do a full in-depth review of that over the coming period, which I think Shona has already indicated. But in terms of the counselling services, yeah, we were very happy with the outcome there. There were no issues in terms of proceeding with them at this point. There's always scope, and as as Mrs. Mitchell-Hill said, there is scope to have a clause in the grant agreements to make sure we can get out at any particular time. So there's no danger of us being stuck with them over the 3-year period. I think the 3-year period is to give the providers that security to be able to work and develop and change the services to meet our needs.
Thanks for that. Sean, would 3 months give you sufficient time to gather the additional information? And if any officer wants to leap in and say, please don't do that, please don't hesitate to leap in. Oh, Mark, sorry, do you want to come up?
Sorry, thanks very much. I must admit, I understand David's concerns, but I have read the paper, and I do think it's been through a lot of processes and the Commission pretty well. So I'm fairly content and assured by the whole process that it's all been looked at quite clearly. So I'm comfortable to go with the recommendations at the moment. I'm not necessarily looking for any kind of extension. So I think maybe what you want to put that out, Chair. Thank you.
David, I wonder if we're going to build that clause in that we'll review it every year anyway, and with an exit strategy, would you be content if we said for the next year, and then with that review period that Shona's already spoke about, she's looking to do that review anyway to ensure that we are getting best value for money? Would that be something you'd be willing to agree to? Thanks.
Yes, it would. Yes, thank you. I wouldn't want to be pushed in against the wall, though, as we are today, for the analysis of the data to be, to the point that we only have 2 weeks or so to make the decision and advise the providers accordingly. So if we could have some additional notice period before the contracts are renewed. I recognise that the counselling, from what Neil said, the counselling services are probably not in question. And again, I do not wish to be obstreperous. I just wish to make sure that we're getting what we pay for and our citizens are benefiting accordingly.
David, I don't think you're being obstreperous, but I could bring Fiona back in.
David, would it be if it was before the next IGB budget meeting, so kind of late 2025, to give you that time? It'll give Shona the time to do the work and also give time to the IGB before, we're looking at budgets and all the rest of it, and it'll give us that information before we have to make any final decision on budgets for the following year. Yes,
thank you.
Hussein?
Thank you very much, John. I just wonder, in an attempt to be helpful, I was taken by David's comment when, and indeed it's mentioned in the report here, that we have 100 counselling services in the city. I wonder, whilst whatever work is taking place in the background to give that assurance, if it may be possible to circulate a service update giving details of what those services are, because I'm sensing perhaps that there is an aspect of, well, what are we actually providing versus what is already available in the city. And I just wonder if that would be beneficial for all members to have that, if it's something that we already have in our records that wouldn't take too much data extraction or time, and that's perhaps something that could be circulated in between now and 1st of July or something like that, just to give officers time to do that.
Sounds sensible to me. Okay, so Jess.
Thank you. Just to try and clarify what the decision is before the IGB then today. So the IG's been asked to make the direction, but the direction itself does need to change to reflect the new time period, which I understand is 1 year. And there'll need to be a new recommendation to the Chief Officer to bring back a report on the review, otherwise to make a decision on the future funding of those grants. Could we just be clear about the date that it's coming back, please?
Thanks. So we bring back a report late 25. Do we need to be more specific than late 25? It's so that would be the 2nd of December meeting.
We have service update.
Oh yeah, and also add the service update into the recommendations. Thank you for keeping us on the straight and narrow. Okay, so sorry, do you want to come back?
As Hussein suggested earlier, some participant reviews would be useful at the services as well, if we can include that, please, as Hussein suggested earlier.
Yeah, can we add that in, please? Yes, thanks. So are we happy to proceed as per the amended instruction, which Jess is busily typing out the words for. Is that okay? Can we agree?
Agreed.
Thank you very much. That will then bring us on to the draft strategic plan, but we need to get Maggie back in. Okay, are we good to go on the draft strategic plan? Yep, in which case, over to Alison.
Thanks, John. So the report you have in front of you is seeking approval for the draft strategic plan to go out for public consultation. As Fiona referred to earlier, the version you have before you is a much slimmed down version to what was planned to come in November 24. The strategic aims have been reduced from 4 to 2, and the strategic priorities have been reduced from 30 to 23. Whilst the evidence document indicates a number of issues that need to be addressed, you'll notice that we're not able to respond to all of these over the lifespan of this strategic plan. And we're having to prioritise our actions dependent on the resources available to us. The aims are firstly focused on making budget savings and service efficiencies in the short term, as well as making preparations for longer term transformation to achieve future efficiencies and create capacity to cope with the forecasted increase in demand and level of need. The second aim is in relation to switching our focus more towards prevention and early intervention, which will be crucial to reducing future demand on the health and social care system. The team have been working hard to understand the current and future budget situation so that we can agree what we can afford to deliver. When submitting these aims and priorities for consideration, we've taken into account not only the budget situation, but also not only the current budget situation, but also the forecasted budget over the 4-year lifespan of the plan. We're aware of what resource we have now and how this will decrease in real terms over the next 4 years. The detail of what we'll deliver in each year of the strategic plan will be presented annually to the IJB for approval, and that will be cross-referenced with the budget forecast so that we can react to any changes in the financial forecast, and what we plan to deliver will be in line with the resources that we have to do so. In line with the aim to become a marmot place, Aberdeen City Council are taking a social determinants of health approach to all strategies and plans, articulating the common challenges of Aberdeen City as a place, with all strategies and plans then going on to detail their particular response to these challenges. A common introduction to all strategies and plans has been developed, and you'll see that in the introduction to the draft IGB strategic plan, along with our proposed response. Joint consultation on 4 Aberdeen strategies or plans is planned. These are the IJB strategic plan, the local housing strategy, the community learning and development plan, and elements of the local development plan. The joint consultation is due to commence on Monday, this coming Monday, the 24th of March, and run until the 14th of May. And feedback from that joint consultation exercise will inform the final versions of all 4 of these plans. That's all I really wanted to say about the draft plan, and happy to take any questions.
So I got Hussein's hand first.
Thank you very much. There are a few points, so please bear with me. First of all, can I thank the team, our officers who have helped to pull this together. It is very different to the draft that we pulled from the November meeting of the IJB, but I think it reflects very well the challenges that now face us. In particular, I think just to illustrate that, myself and I think you as well had the opportunity to meet with those who are working on the plan just a couple of weeks ago, and we see changes in the document even since then. So it is very much a live document. I'm particularly pleased to see the use of personas, because I think that will make the strategic plan more digestible to the citizens that we support. They will be able to see in the strategic plan their own circumstances and also how we as an IJB and as a health and social care system intend to provide services to support them. I'm pleased to particularly see recognition of chronic pain, that won't surprise anybody, and also long-term conditions with an estimate of anything up to 43% of the population of our city affected by them. I do wish to suggest a couple of amendments to the engagement and communication plan, specifically around BSL. I note the intention to consult with North East Sensory Services, and they do support people who are deaf and hard of hearing. But BSL itself is a language, and those who use BSL often face even more serious challenges in both taking in information, but also in having their voices heard. They are probably one of the most seldom heard communities, simply because of that additional support that they require. And I would like to see BSL specifically mentioned in the communication and engagement plan, so that we take cognizance of that, but also so that as an IJB, we send a very strong signal that we recognize the needs of that specific community. I have a couple of questions. So I'm very pleased to see mention of closing the feedback loop, and that goes hand in hand with the putting people first principles that the IGB has supported previously. I think there's a real opportunity there to also signpost people to services. So it's one thing telling people, we've heard you, here's what we're doing. It's also telling people, we heard you, here's what we can't do or we won't do, and giving the reasons for that. But that's a real opportunity, I think, also to say to people, we can't meet this request because with the best will in the world, we can't do everything. But actually, here are services that can help, whether that's from the third sector or city council. So there's potentially an opportunity here to meet even more unmet need through this process. I do have a specific question just around timelines, if this is going to be brought back to the IJB on the 1st of July. Would the idea, just for clarity, be to approve that plan and then it goes live? Or is the idea to be that we take the feedback from our citizens, approve that feedback and the refresh of the plan, and then reconsult? So it would be helpful just to have a bit of clarity. And I'll stop there for the moment.
Thanks, Hussein. Certainly happy to take on board your couple of comments in relation to the consultation and engagement in terms of the mention specifically of BSL and that further enhancement of closing the feedback loop. So not just feeding back, but also signposting to other services if we can. So certainly happy to do those two things. In terms of timelines, the plan was to take the feedback, as I say, the feedback, the joint consultation process ends around about the 14th of May. So that is in time for us to incorporate feedback from that into a final draft. We'll also be working on our first annual delivery plan at the same time. And that feedback should hopefully inform that as well. So the plan would be to bring the final IGB strategic plan to the 1st of July meeting, along with the first annual delivery plan for that strategic plan for final approval for immediate publication and implementation beyond that.
Thank you very much. You just reminded me of my my other question. So there's mention here that we're going to be jointly consulting on a number of strategies, and I think that's very helpful because of the consultation fatigue that I think we're all aware of, just in our own lives. Never mind anything else. I'm just wondering if you could give some detail as to what approach that will be taken, because if you look at all of the 4 strategies that are mentioned, they all focus on different aspects of life, but they all have an interconnection between them. So just to give a bit of understanding and for people's awareness as well, is the intention to focus on them as 4 separate documents? Or is the intention to say to our citizens, here's the aspects of your lives that we're consulting on. Tell us how this all matters. And essentially then the work to separate that into what that means for the different strategies is done internally. Or is the suggestion to present citizens with 4 different documents and do 4 different questionnaires? Because I'm just thinking there are advantages and disadvantages for both of those. But equally, what you don't want to do is have people, be really enthusiastic at the start, and then potentially, through various reasons, they lose things as they go along. And I have one final supplementary after that.
Thanks, Hussein. So the approach that we're taking is we're actually using the place standard tool. And we've taken the elements of each of the 4 strategies and fitted them into the place standard tool. So it is your sort of second option there, if you like, in terms of it's about what matters to people and what each of the strategies or plans are proposing in the drafts that are in front of them. The full strategies will be available for people to look at if they want to do that and make particular comment against other aspects of the strategies or plans. But the lead in, the way that people will be led into the consultation will be through that place standard tool approach. The personas will also be made available separately for consultees so that they can have a look at those and hopefully recognise either themselves or family members or friends in some of the issues that are highlighted there.
Thanks very much, Alison. Just a couple of technical points now. If I can just put a plea in, if we can look very carefully at how that workflow process is going to work, especially for the online consultation, because I think we all know what it's like if we have to jump around and look at different documents in different places and have multiple tabs open, and that obviously makes things a little more complicated for all of us, but particularly for some of our users could add an additional complexity. Secondly, if I can ask someone to please look at the online system to see if it's possible to incorporate either now or in the future a way to save your progress. We had very specific feedback from some users during the budget consultation and previous consultations as well, that the sheer amount of time that sometimes took was a barrier for people who had that time to give but wouldn't have it to give cumulatively and wanted the opportunity to sometimes come back. And there were some reports that wasn't always feasible or possible. So, you see that on some survey platforms, you can come back and save your progress and carry on. If there's a way we can do that, it might just help to give people that little bit more incentive if they know that they're not going to have to spend X amount of time on the consultation all in one go. Yes.
Thanks. I can assure you that there has been a whole team around about the development of the process, and that has included the Equality Officer from Aberdeen City Council. So hopefully the accessibility issues have been resolved. I can't answer specifically around about whether you can save your progress or not. I'd need to go and take advice on that, but I'll certainly raise that point this afternoon, and hopefully that will have been addressed as well. We did look at the budget consultations and learned lessons from that to feed into this process. So hopefully that will have been taken into account, but I'll confirm one way or the other out with the meeting if that's okay, Hussein.
Okay, any more Comments, questions? Got Martin and then Councillor Mal.
Yeah, thanks, Chair. I think that the plan does create quite high expectations for the consultation and engagement activity, but that is a really crucial aspect of what we're trying to do, to look to the future, to embed the prevention and early intervention agenda within all that we're doing in health and social care. So engaging with the groups, with the lived experience groups, with the locality planning groups and organisations and so forth, will require quite a lot of intensive time and energy. And I'm just wondering what can be realistically achieved. There's a very helpful list of the internal engagement that's been undertaken in producing the plan, and then there are some proposals for attending events, having meetings with various groups and so forth. So it will be, I think, quite demanding to make sure that we're working face to face, listening to people, taking in their comments, processing them, accepting them, and in some way evaluating and feeding back. So it's just to get a sense of how that will happen, because the public will realise that we're on the same journey, which is a journey of dealing with of tackling inequalities. That's our key aim. Our key aim is to care for the most vulnerable, and as the paper mentions, there are rising levels of individuals with life-limiting conditions, people living longer. It's a lot of information to share and to seek feedback. So I just think it would be useful to have a sense of how we're going to have that conversation, so that it's meaningful.
So as I mentioned earlier, there's a large team of people around about this, and there's a lot of planning gone into it. And that's certainly one of the benefits of doing this jointly with other colleagues in Aberdeen City Council, because that's enabled us to sort of augment the team of people that would normally be consulting. We'd normally have a much smaller team. And there's been a lot of preparation in terms of notes for those people who are going to be delivering the consultation sessions, so that they are all up to date with each of the aspects of the various plans that we'll be consulting on. And there's a team site where the individuals who will be undertaking the consultations will be able to chat to each other and quickly message each other if there's any questions that they perhaps can't answer, or if there's just some feedback that they want to give to others to help each session as it goes forward. So hopefully with all the planning and preparation that we've been doing over the last 3 months or so leading up to this, will make for a useful session, and will make the best use of the resources that we have available to us.
Could I just come back very, very briefly? I think as you mentioned, that the alignment of services and partners, so that we're very focused and targeted in what we're looking to achieve. I think that's very important. That will help us to share resources, so that we're talking to the public and others with a unified voice, and that's very positive. That helps to reinforce our messages, and I think that working with the Marmot initiative, with the HDRC and so forth, that gives us momentum. But but our key partners are people, are individuals and residents. So that's very reassuring to know that we're looking to bring people along and not talk down to them. So very helpful. Thank you.
Okay, Councillor Mike.
Thank you, Convener, and thank you very much for your report. On page 145, of what you call the evidence document, you speak about risk, then you list the risks. Then on page 155, you speak about risk and mitigations. Can you therefore outline to members what, for example, is the potential failure of commission service to deliver on their contract, or the risk of demand outstrips available budget? Because the document makes no mention of how these risks are going to be tackled.
So in terms of commission services, we have built up really good relationships with the providers that deliver social care services. We work closely with them, and we are talking to them. We've got various provider engagement events where we are keeping them appraised of our budget situation and the types of efficiencies that we need to make. So we're working really closely with them and to try and ensure that we can still deliver the crucial frontline services that we have to deliver with them as our partners.
Thank you very much. But you highlight the risks, but can you please tell us how you are going to tackle these risks?
So in terms of managing demand and continuing to deliver services, that is what our focus is on for making efficiencies in the initial budget savings, and also the transformation activity that we're looking at. We haven't detailed everything out yet, but we're going to look at all the areas and see what efficiencies we can create to create more capacity to ensure that our services going forward will be sustainable.
Can I just bring in Amy and Fiona on this point?
Yeah, thanks very much. Particularly the forward financial plan looked at how commission services could be managed going forward. We're specifically looking at technology-enabled care. We're looking at, our citizen app, and we're looking at working really closely with providers. Certainly, we have monthly forums with our providers. The last one, we had 83 of our providers attend. I think they are aware of the position we're in. They understand how we want to change going forward, and they want to be part of that, and very much volunteered that as part of the journey that we all go on together, which helps us manage that financial risk going forward.
I heard that you said about the saving. Can you give us some more information how you're going to save while you are going to tackle these risks?
Certainly, maybe an example looking at technology-enabled care. So some people need 24/7 support, but if you use your technology, you can have a camera in the room, you can have a choke sensor in the pillow, so you don't necessarily need to looking with that person 24 hours a day. So that reduces their care need potentially to 10 hours a day. And potentially the service that you're sitting around them provides greater care for that person than would otherwise be the case. That's why it's really important to work with providers. That technology would sit in their property, their buildings that we're looking to buy the service from.
Excellent. Thanks very much for the clarification. So my last question, Convener. The report indicates the draft strategic plan was originally scheduled to come to IGB meeting on the 19th of November 2024 for approval to go out to for a public consultation. It became apparent, however, that there was a need for a greater clarity on our budget position before we could make comments to any activities in the strategic plan. What makes you content that the issue that stopped the original draft plan coming on 19th November 2024 have now been addressed? And how comfortable are you now in this draft plan, giving our finances have worsened than got better?
I think for us, we really understand our run rate now as an organisation, and we understand what we spend each month in relation to what we want to spend going forward. And it's about making the changes around how we deliver service within the financial envelope that we have each month, which helps us underpin the delivery of the future strategic plan. And we're looking at gradual change throughout that period of time. So it's not as if it's the same level of savings in future years that we're looking to really drive forward in 25, 26 year, which allows the strategy really to come to the fore and set the direction over how we will be spending our funding in the future.
Sorry, Convener, I said last question, just supplementary. Thank you. It'll be definitely last. So thank you very much. You said that you understood that how you can spend monthly base. So if I have £1 and I go to the shop and I buy something for 150, it's not possible because my budget is only £1. So how we are going to control our spend?
So in relation to the budget that we've put forward, we will control our budget spend by really being aware of what budget we have across our cost centres and what we're going to be spending each month. The review at the end of the month is really important so we can control that expenditure. And as I was saying earlier, it's about making sure the budget is appropriately phased throughout the year and it matches with the savings that we want to bring forward so that we're completely joined up. And so all the budget holders are bought into that programme as well. But the opportunity that we have already, we have in place really strong financial control. We will continue to use that same process through the course of the financial year to make sure that our spend plans are in line with our budget.
Okay, any more questions or comments? Not seeing any hands. I mean, the only other thing I would add on the budgetary control is that we have put in place a tighter and more rigorous control mechanism, which will help us to manage the budget. But that's on the back of internal audit saying that our budgetary control mechanism was adequate, which in order to speak is good. So we're building on a strong basis. So we did have a question on the. Sorry, did you want to come back?
No, thanks very much. No more question. Just I would like to try another attempt. If somebody can second me, I have an amendment can be circulated. Hopefully I'll be third time lucky. Thank you.
In which case, can we have the amendment circulated, please? We're again having just a few technical hitches, but hopefully it'll get circulated any moment now. Just give folks a couple of minutes just to read it. Okay, it's a relatively short one. Has everybody had a chance to digest, read, think about? Yep. Okay, so back to the same mechanism we had before. I think it's competent technically. Do you have a seconder?
No, unfortunately, Convener, I can't get. Thanks very much. And before we can conclude the business, I would like to thank our officer, and also I would like to thank Councillor Jennifer Bonsall for her service, and of course, Mr. Bell, and all the best for your new venture. And just I have a small concern that this committee is not robust, where different our opinion cannot be heard, and we cannot debate on a very important and crucial issues, something like finance. But here we go. What else I can do? Thank you.
Okay, can we agree the recommendations on the draft strategic plan, subject to the addition of BSL, etc., as discussed? Are we okay to do that?
Same again, Convener, my dissent can be
Okay,
limited. Thank you.
noted.
Thanks, John. Yep. Okay. So the housing contribution statement is a requirement of the Public Bodies Joint Working Scotland 2014 Act, and it's the responsibility of the Integration Authority to produce this. It's produced in conjunction with colleagues from Aberdeen City Housing and reflects the close joint working arrangements that are in place between them and ourselves. We have in the past incorporated this into the strategic plan. Throughout the strategic plan, however, at this point we are proposing that it's a separate document which both the IGB strategic plan and the local housing strategy will link to. And I've appended the draft local housing strategy that was approved at committee last week, and which will be part of the joint consultation that I mentioned earlier. We'll bring back a final version of the housing contribution statement along with the IGB strategic plan to the IGB meeting in July. Feedback from the joint consultation exercise in relation to both the local housing strategy and the IGB strategic plan will inform that final version. Happy to take any comment.
Okay, any questions for Alison? Richie?
Yeah, again, thanks for the paper. It's one, I guess, on housing support and enabling our citizens to be able to stay at home for as long as possible in their own home, in their own housing. And I guess just looking for assurance around that coordination across housing services and health and care services that either would allow people to stay at home for longer and safely and securely, and equally, I guess, in terms of enabling folk to come out of hospital safely and securely and quickly in terms of getting back home. So I guess any kind of comment around or assurance around how that coordination, that engagement takes place would be helpful. Thanks.
Thanks. Yeah, there's lots of joint working between ourselves and housing. As I say, there's various forums. So we've got the Disabled Adaptations Group, we've got a Delayed Discharge Working Group, we've got Sheltered Housing, Very Sheltered Housing Allocations Group. We're all where the partnership and housing are all represented. So we have these discussions. We always put the citizen of Aberdeen City at the centre of all decision making, and we jointly discuss what's best and ensure that we don't neither of us make decisions that are at the detriment to the other.
Next. Oh, sorry.
It's just to say we've got approximately £2 million that we spend annually to support people in their own home, to make sure that we don't have the delayed discharges from hospital, so we carry out the adaptations quickly in their home through our care and repair service that's supported by Castle Hill Housing. And I think that all goes into providing the robustness behind the strategy.
And Kenneth, and sorry for, I thought Amy was coming in on that point. I thought it'd be sensible to take it there.
On page 235, there's talk about building more affordable housing, and there's mention of options for different funding opportunities for building more affordable homes. I just wondered if you could expand on what the funding opportunities are for affordable homes, if it's possible.
Is that part of the local housing strategy? Okay, sorry. Yeah, sorry, I'm not able to respond to that. I don't know.
Thank you for the
I think
question.
Kay can contribute it.
Thank you. So the funding mechanisms are obviously shifting. We've recently had quite successful, quite a bit of success, with quite a degree of success in one of our ongoing programmes of work, which is due to complete in June. A slightly different funding model to perhaps the more traditional. We have identified that some of our registered social landlord partners are keen to do more work with us, where they will fund the capital build. So that obviously means that the local authority doesn't pick that up, but we are, with working in partnership with Housing Strategy within the council, able to access affordable housing supply monies from Scottish Government. So all of those opportunities are currently being identified, and we do have a couple of opportunities within the programme for supported accommodation for mental health and learning disabilities at present, and potentially other substance use, for example, is another programme that we're looking at presently, where we would have assistance with capital build, but very much a sort of city-wide approach rather than council and partnership. So looking to sort of develop stronger partnership working around about those areas.
I just wondered if there's any scope for utilising things like enterprise investment schemes to raise capital.
Thank you. Yes, the social impact bond is something that we're conscious of, which may give scope with third sector partners out with the traditional approaches that we've taken to capital build.
Thank you.
Okay, any more questions, comments? Not seeing any hands. In which case, yeah, thanks for the paper, Alison, and can we agree the recommendations? Okay, thanks very much. That then brings us to, it would have been exempt business, but we haven't got any. And then the final thing is just to note the date of the next meeting, which is going to be on the 13th of May. Although before then, we've got an insight session, I think week today. We've got a culture sounding board on the 1st of April, which I hope is not a bad omen. It's usually a very good meeting. And then we've got a topic specific seminar on the 22nd of April. So, oh, Hussein, sorry.
Yeah. Thank you very much, John. Just before you close the meeting, I would just like to thank you for your tenure as chair over the last 18 months. You leave a very large set of shoes for me to fill, but I'm pleased that you won't be disappearing anywhere anytime soon. But I just wanted to put on record my thanks for your stewardship and your chairing and keeping us all in order. Thank you very much.
Thanks for that, and I'll give you the brown envelope full of fivers later. So yeah, thanks everybody for your contributions, and thanks to officers for all the hard work as ever, and enjoy the rest of your day.